All right, ma'am.
Right.
We'll start.
Yeah. So, as per the card, if you understood it well, see, it is a maternal and child welfare clinic, and you are talking to a young mother who is facing problem with her child who is 18 months old boy. His name is
Yes.
Jack, and because of the he continuously is crying, and he is having a fretful experience, and mother is worried. What is the main reason? So she has brought the child to the clinic, and you have to discuss with the mother. So you have to examine, and so what is the condition of the child? You have to speak and how to handle the situation. Okay,
Oh, yes, ma'am.
right. You could start it.
Okay. Good morning. I am Miss Padmaja, a child health welfare clinic nurse. How are you?
Good morning, Nurse Padmaja. Good to know that you are going to attend my child. Yes, my name is Sarah, and my son's name is Jack, and he is 18 months old. Let me give a brief introduction. What is the problem my child is facing? Actually, he has been into quite fretful experience as well as crying continuously almost 3-4 days. I could not find the real reason. That's the reason I brought him over here.
Well, Sarah, not to get afraid, let me examine your child. Can I do the examination of a child?
Yes, nurse, you could go ahead. Please do it.
Okay, just 2 minutes. Hello, Jack. How are you? Okay, let me check. So I have examined your child. Nothing to worry. Just
Okay.
relax. Yeah, he is having a problem of teeth eruption. So his gums appear to be inflamed, and that is why he is very much fretful and he usually cries. You could see this first molar tooth which is erupting out. So not to worry, this may be a problem of tooth eruption, and usually this occurs in all children at the age of 6 months onwards till 8 months. So
But he is 18 months old. Nurse, actually he is 18 months old. And do you say that the teething problem could settle on its own? And he is 18, actually, as he told, 6 to 8 months, right? He is 18 now.
Yes, there are some children, they may get this teeth eruption little later, but doesn't matter. You can you just have to take care of his teething. Can you tell me whether he takes his feed properly?
Yes, see, actually, up to 1 year, I was breastfeeding my child along with that other, extra liquid, semi-solid food I had incorporated from 6 months onwards. Now he is 1.5 years, almost 18 months. So I started to, breastfeed, and I just more concentrate on solid and liquid diet. So earlier he was good at eating and no problem. As I told that almost a month he started to have this problem. He's a fussy eater. He cries continuously. Even during sleep he cries, and it's quite unconsolable.
Can you tell me whether he gets fever when he cries usually?
Um, it's not like fever, but as he's continuously crying, and we could not console him, we could not pacify him, and he's not going to anybody other than me. All the time we need to cuddle and swaddle him. So little frustrating.
Well, this could be a problem of pain which he is experiencing, but I would like to give you some suggestions. That there are some medications or teething gel which is available in the chemist with the doctor's prescription. I would like to give you. You can buy this teething gel from the chemist, and you can apply over the baby's gums wherever you find that inflamed gums are there. All over the mouth. Usually this where the teeth are not erupted. And second thing, what you can do is there are teething toys which are available in the market. You can find it, these teething toys which are very soft and edgeless, which does not harm a baby. Usually when the baby will feel that fretful experience, you can give this teething toys. Usually, these teething toys, if you can keep in the refrigerator a little cold, so that may relieve the pain of the baby, which the baby is experiencing. Or else you can do one thing: you can give a apple piece to chew for the baby. So with this, he may get little relief from the pain. And if at all, if the baby does not stop crying, you can give the dose of paracetamol mixture, what is been recommended by the doctor. I hope you must have understood what all things you can do
Sure,
to
nurse,
relieve.
I do understand, but I have a doubt, and it was told by my mom also that he is, and also as he is not able to stop his cry, right? How do I stop a colicky baby like him? And because continuous crying is, definitely weaken the child, and it is quite, it's a terrible experience mentally as well as physically, child as well as for others, right?
Yes, Sarah, not to worry about it, but I think that with this, if you do this for
So
your
my
child by
question is how to stop the colicky baby. That is the thing.
collar pain.
Colicky, Colicky, colicky.
Colicky pain is like a crampy pain which the baby is having. Do your child is having a loose motion? What is
Yes,
the
yes. Almost some 2 3 days I've observed that he has no diarrhea or loose motion too.
maybe this may be a result of infection, because usually what happens, the baby when it that urge to bite something because of that inflamed gum, he may take any of the object into his mouth, and that may cause infection. So well, this may be a cause of infection where you need to see a doctor. So I will take you to the doctor. Whatever if he gives a medication, maybe he require an antibiotic. After giving that antibiotic as well as anticolicky, some medications will be given which can relieve the pain of the baby.
Yeah, you are
And of
right,
course,
nurse. Actually, he started to bite each and everything, even the fingers of his own and our fingers. He starts to bite each and everything, wooden table, anything, that is given immediately he starts to bite. That, behavior he has got, that grundling behavior he has got.
all right, Sarah, to reduce this only, we need to take care of that the child does not get infection. So what is to be done is to see to it that the things which are available here and there, he should not reach out to it. The teething toys are the good type of toys for teething. Especially, it has to be washed thoroughly and stored. And even if you want to give it to the baby, it has to be given in a very hygienically to the child, so that the child bites to it and does not get any chances of infection.
Well,
So,
no, so I do need to know because, is there any proper way to hold and cuddle the baby to make him sleep when he cries? Because continuous cry, he's fretful, he's crying, continuously screaming. Even night times, once he gets up from sleep and cries, we could not make him to sleep 3 4 hours. So is there any method that we could follow in order to cajole and pamper and make him to sleep?
all right, Sarah, baby is 18 months old, and if you take your baby near to you, that may give a warmth of your body to the child, and maybe this may help the baby to be like having that secured feeling. And the medications will definitely work for him. And if you cuddle the child, like when you want the child to go to bed, you just have to breastfeed. See to it that the baby's stomach is full, the baby has taken proper feed, and check for his nappy. And see to it that like what you see, cuddling and little um, uh, just swagging, if you do for the baby, it will help for baby to go to sleep. I hope I'm clear for you.
Yeah, sure. To some extent, I have got clarified all my doubts. Yes, we could arrange for the no meet with the pediatrician, so I could check with the pediatrician to get to know the real suffering of him, so the proper treatment could be started. Thank you, nurse.
Welcome.
Right. So when I told that, check with the pediatrician, for that you have to say, yeah, definitely pediatrician is available. Few minutes you could wait. I just take an appointment and get back to you. Yes, you are right. Pediatrician is the right person to assess what is the real problem for the child. Okay. And next to that, I asked you continuously, he was not sleeping during night time. Once he started to cry, he was screaming and crying. He was fretful, unable to make him sleep 3-4 hours. So for that, how to, some checklist is required in order to help the crying baby. Okay, you could say that you could cuddle the baby and you could, sway back and forth, and you can swaddle him. And also this method, something, see, whenever you are feeding the baby, don't make him to sit in one place. Make him to walk or run or play while you are feeding. So automatically the digestion could be there. And give him small portions of feeding, not three meals. So make it as 6 meals, like small portions that you could give. And start to make him eat vegetables and fruits, raw, like carrot, small, like julienne you cut and give. So that could also be helpful for the baby to get into the habit of eating good diet, and at the same time that could could to some extent, as he is having this problem of teething, so that tether, that could be helpful too, rather going only for the tether. This way also you could help your child. Okay, and see to that after eating the child is getting the burp properly, otherwise gas could have formed in the stomach, and that could also get some kind of cramp or pain. And try to avoid using at home the diaper or napkins. Always wearing something tight next to the stomach, that you could avoid. And as your child is 1.5 years old, get him into the habit of toiletry, to how to urinate, and before sleep, you just see to that the child is emptying his bladder. So this all some kind of everyday simple natural methods that you could follow to make your child to get a good sleep. That also you could see. Okay. Because mostly they say always that diaper they just keep, that also could develop some kind of rash. Though the child is 1.5 years, could not express what is the real concern. And mainly because the colicky, as I asked, that is very important question. So how to cuddle? It doesn't mean that only 6 months old or 8 months old. Even at times, up to 2 years also, the child could have that. They would not. It's quite difficult to stop a colicky baby. So how to cuddle, how to pamper, how to hold the baby close to, and to make the baby